In this lecture module, we will discuss agents that are not part of conventional medical therapeutics, which means that these are not part of the allopathic spectrum and are often categorized as health equivalents that are mostly over the counter and self-prescribed. Let's get started. Pause the video at this slide and view the broad objectives. By the end of this presentation, you should be able to feel confident on these goals of the presentation. In this section, let us introduce these group of products that are collectively called complementary and alternative medications, or CAMs in short. What are complementary and alternative therapies? These can mean a host of items. In general, they indicate use of treatment approaches that are used in addition or as substitute to established course of conventional treatment, such as herbal remedies, naturopathic and homeopathic treatments, etc. These include, among others, medications, yoga, acupuncture, and a host of other interventions. They do not always mean they work, however. Steve Jobs, the erstwhile founder of Apple Computers, tried fruit-based diet for treating his cancer, and the resulting outcome is well known and documented. By the time he sought regular medical care, his cancer was so advanced that no conventional treatment would work any longer. What are alternative medications specifically? These are products that consist of a variety of natural substances that fall outside of conventional pharmacotherapeutic agents such as herbal preparations, vitamins, minerals, and other nutritional equivalents that consumers take to promote optimal health or to treat various conditions. These products are classified as dietary supplements by the Food and Drug Administration and therefore is not subject to rigorous testing and scrutiny required for prescription drugs or many over-the-counter drugs. All the products that are classified as CAMs until recently were not taught in US medical schools, but more recently the trend is changing such that medical students are now being increasingly oriented to these substances, not in any small part because of the risky interactions that these products may cause with prescription medications. See a more thorough discussion at the provided link on your handout slides. Chems can be largely grouped into four major categories. They are biologically based therapies, mind-body interventions, manipulative therapies, and energy therapies. Such classification is better seen in the image on the next screen to conceptualize this method of categorization. As you can see, the four large classifications that I just mentioned are shown here. We will not be able to talk at length on all of these camps in this presentation. However, we will address biologically based therapies which are relevant to this course. Complementary and alternative medicines such as acupuncture, herbal supplements, and meditation are big business in the United States, totaling nearly 34 billion in out-of-pocket spending according to a government report released in July of 2009 as reported by Reuters at that time. Certainly, interest and usage has grown in this area dramatically over the past decade. The global complementary and alternative medicine market size was projected at USD $69.2 billion in 2019, registering a compound annual growth rate or CAGR of 19.9% over the forecasted period. The prevalence of actual extent of use is hard to determine, but conservative estimates of approximately 38% of adult US population use some form of CAM. Yoga, meditation, magnetic intervention, acupuncture, and complementary wellness treatments are gaining immense popularity across developed countries. This can be attributed to wide acceptance of these alternative treatments among general population, further causing an upswing in the number of yoga studios, meditation centers, spas, and complementary wellness facilities. This usage has been fueled by media of all types, including the internet, among others. But perhaps the greatest growth has been fueled by unregulated advertising and poor analytical ability of a great number of non-medical lay people. Government initiatives play a pivotal role in boosting adoption of complementary and alternative medicines. In addition, increased funding, establishing government facilities dedicated to complementary therapies, and the expensive nature of conventional treatment options are some of the secondary factors encouraging companies to invest in the market for complementary and alternative medicine. Alternative medicine is expected to become more mainstream in the coming years, especially in the developed countries. This can be attributed to a new acceptance displayed by physicians and doctors in the United States towards alternative philosophies and treatments that were conventionally excluded from mainstream medicine. Advent of integrative medicine has proven to be profitable for propelling the penetration of complementary and alternative treatment. Professionals state that the integrative medicine has the potential to address an array of patients' influences, including environmental, emotional, physical, and spiritual growth. Robust investments in this direction began in the year 2016 and has continued to evolve since then. For instance, Andrew Krupp, a late philanthropist, granted approximately USD 30 million to the Center for Integrative Medicine in California for a research program covering this area. This program was designed to analyze the potential benefits of exercise, diet, and natural therapeutics in the treatment of various chronic ailments such as cancer and heart disease. There are many misconceptions about camps that is perhaps the most important thing to remember for a professional. Because many of the biologically based therapies are derived from natural sources, for example, herbs and other plants. Therefore, some consumers may be lulled into false sense of safety and security as being quote unquote safer than synthetic or manufactured chemicals. Another misconception that does occur is that the consumer feels that natural product can be consumed in indiscriminate, perhaps unlimited amounts without chance of harm. However, such theories are pure misconceptions, fake news of modern times. These misconceptions can lead to serious complications, some of which are discussed in the next slide. An example can be made of ephedra, an extract of evergreen shrub. Ephedra contains a potent neurotransmitter by the name of epinephrine, which is a powerful alpha and beta stimulant drug. It can secondarily cause weight loss and enhance athletic performance. People were lured to take ephedra based on its natural origin and strong advertising by the manufacturer in early 2000s. However, what was lost in translation is that ephedrine is also a potent activator of autonomic beta 1 receptors present on the heart, as well as the autonomic alpha 1 receptors present in the blood vessel walls. When activated, it can lead to heart attacks and strokes in susceptible individuals. That is precisely what happened with the ephedra drug, which was sold on the unregulated market as a chem. In 2004, after a series of tragic accidental incidents leading to multiple deaths and strokes, the FDA banned ephedra in any form, and it is no longer available on the regular market. However, this drug is still marketed and available on the black market with tragic consequences. It is a prime case example of post-marketing surveillance that works for conventional allopathic agents in a more orderly manner but escapes scrutiny when these drugs are taken in non-prescription form. Another consideration is that many people are either unaware of the need or just reluctant to discuss their use of CAM products with their physicians, nurse, pharmacist, or rehab therapists for various reasons, not the least of which is fear of criticism for being unscientific or not consistent with conventional healthcare. This lack of reporting is dangerous when these CAMs interact with traditional medications and lead to adverse reactions in various forms. CAMs can also alter the metabolism of other medications, requiring either changing or discontinuing traditional medications to avoid an adverse drug reaction. PTs must be alert to such usage of CAMs in their patients and encourage them to disclose their use with their physicians. In this regards, keep an open line of bidirectional communication between patient and their primary care physicians and establish a constructive, non-judgmental dialogue with patients about potential benefits and serious adverse effects of complementary and adverse and alternative medications. Many CAMs are classified as food or dietary supplement. Hence, these substances are not subject to strict standards for quality and purity as traditional medications are. Active ingredients in certain products may vary considerably or may be inadequate to have a therapeutic effect. This appears mostly true of CAMs derived from plant sources. Some other issues that are important to consider is that some patients, or rather plants, contain toxins which, while growing naturally, remain sequestered. However, these toxins may enter the biologic material inadvertently and thereby enter the patient in due course of time. Another issue is that the wrong plant may inadvertently be harvested and subsequently marketed as a specific CAM. Hence, all healthcare professionals have to be aware that the quality of CAMs may vary from manufacturer to manufacturer and even within the same manufacturer. Poor quality is rampant in this unregulated industry. And instead of benefit, the consumer may end up with harm from several angles. This is the crux of the importance of education that the healthcare professional imparts to their patients during routine surveillance of all pharmacologic active substances such as CAMs. The consumer is king in deciding what they want to consume. Often they will rely or over-rely on alternative medications based on personal beliefs, whether societal, religious, or other influences. However, CAMs can often negate the effect of traditional medications delay their onset of action, or delay the proper treatment so far that eventually the traditional medication or treatment may not have any therapeutic effect at all. Healthcare professionals must counsel the patients to avoid over-reliance on these alternative medications and to seek conventional medical treatment if symptoms fail to resolve quickly or if they worsen with alternative medication use. CAMs are generally safe when taken as recommended by the reasonably healthy adults. However, they can interact with conventional meds and increase or decrease their effects. They can also produce toxic effects on various tissues and organs and can influence the absorption, distribution, metabolism, and excretion, or also what we refer to as the ADME of the conventional medications. Some major considerations in how CAMs can influence metabolism is that they can actively inhibit enzymes that normally metabolize conventional medications, thus resulting in increased levels of active form of the conventional drugs continuing to circulate within the system. Conversely, in some cases, CAMs can induce the liver to produce more enzymes that break down the conventional medications. This process, where the liver is stimulated to produce more enzymes, is known as enzyme induction, something that the body has quote unquote learned over the millennia to process and break down chemicals that the body is exposed to. This topic of enzyme induction would have been covered in chapter 3 in details, which is part of your fundamentals of pharmacology. When CAMs induce excessive enzyme induction, it can break down conventional drugs before their maximal benefit has been derived, and an underlying disease may continue to progress despite the patient taking the conventional medication as well. There are other risks of adverse injuries involving inappropriately taken excessive or prolonged dosages of CAMs, which can produce toxic effects on various tissues and organs. In particular, the liver, which processes all chemicals ingested, may be at high risk of failure, and this has been documented during inappropriate CAM use. Other organs affected may involve the heart, lung, kidneys, and even bone. An interesting case was reported from Henry Ford Hospital in Detroit, where a 47-year-old woman was referred for bone pain and abnormal findings on radiography. The radiographic images are shown at the link on this slide. This lady stumped all the medical experts, and it was considered a particularly aggressive form of bone cancer until an accidental discussion in the presence of a physician trained from India who was not on the case led to an accidental discovery. The patient reported that for the past 17 years she had been habitually consuming a pitcher of tea made from 100 to 150 tea bags daily. Due to the knowledge of previous such case, the physician was able to stop the tea, and over a period of months, the patient recovered completely. If you can obtain this case report from the New England Journal of Medicine, I encourage you to read it. I have provided the link on this slide. Finally, CAMs can also produce direct side effects and adverse reactions similar to conventional medications that include gastrointestinal disturbances of nausea, vomiting, headaches, and diarrhea. They can also cause allergic and various other reactions even at appropriate doses. As of now, adequate clinical research into the proper dosage and pharmacokinetic actions of CAMs is not readily available, and any claims to the contrary are not verifiable at best. These are the major takeaways from this group of drugs, as professionals must be able to supervise, analyze adverse reactions, and educate patients on these potential adverse effects of CAMs suitable for each person's level of education and understanding ability. This slide and the next slide list some of the specific CAMs and is taken from your textbook, Table 38.1. Use these two slides as a summary guide and review the text for the source from where obtained and the primary usages of these products. And some more of the same um, from the previous slide and here. Be sure to check on glucosamine and chondroitin, two products which are used as disease-modifying osteoarthritis drugs or DMODs. See the pain management of arthritis chapter and mind map for more on these two CAMs. Also read the information on these items under chapter 38. We will now look at a specific CAM, which are vitamins. Vitamins are a diverse group of organic chemicals that the body needs to facilitate specific metabolic and biosynthetic processes. Vitamins can be enzymatic cofactors that can help catalyze processes within the body. In other situations, vitamins are needed as an integral part of specific chemical reactions. The body typically needs very small amounts of vitamins to promote normal growth and development and for optimal health throughout adulthood. Most vitamins cannot be synthesized by the body and must be supplied from an outside source, typically in the ingested form, which means somehow the human being must swallow it. What is most interesting is that a healthy, balanced diet provides all the nutrients that the body needs, including all vitamins. However, somehow, consumers are made to believe by commercial advertising that they need vitamin supplements, which can then be purchased without a physician prescription and consumed. Certainly, some medical conditions may require professional strength prescription strength vitamin replacement, as in antibiotic use, which requires supplemental vitamin B replacement. If regular dietary supply is inadequate, vitamins may be consumed as supplements. In some diseases or disorders, the bowels may be surgically shortened inordinately, such that normal vitamin absorption may not occur. Examples of such surgeries include Billroth 1 and Billroth 2 for cancers, and also bariatric gastric bypass surgeries. In such cases, supplemental vitamin delivery has become the standard of care, but these are prescription medications which are very warranted. These patients may continue to need these supplemental prescription vitamins for their rest of their lives. Other situations can occur when the body's natural demand exceeds what can be supplied in the diet. Example of such situation is pregnancy. For example, folic acid is essential for both mother and development of the fetus, especially the spinal cord. During such times, prescription vitamin supplements are essential. The notion that self-prescribed intake of excessive amounts of vitamins will promote health is dangerous. Hypervitaminosis is a well-recognized complication of taking too much of non-essential vitamins, as these tend to accumulate in the tissues and organs, some more than others. This is especially a concern in fat-soluble vitamins, which are A, D, E, and K, which tend to linger in the fat layer long beyond its required benefit effect. Water-soluble vitamins are less of a problem as the body is good in secreting them in the urine. This can lead to various signs of toxicities, including drowsiness, headache, fatigue, nausea, muscle weakness, kidney dysfunction, liver and spleen enlargement, among others. The takeaway for healthcare professionals is to regularly survey the medications that the patients are on and educate them on the risk of indiscriminate use of vitamins like other CAMs. If nutritional deficiency is a concern, the patient can be referred to a registered dietitian who can analyze the patient's needs and make appropriate replacement recommendations. Next, we look at another CAM, minerals. Another type of small chemicals that play vital roles in our physiological processes is minerals. Recall from physiology that minerals such as sodium, potassium, chloride, and calcium are part of every cellular function along with water homeostasis, and together with some other minerals are all essential for life. The other minerals that are not mentioned here are called trace minerals and are not present in any quantity in the body, but are essential for specific cells and tissues in the body. Review the physiologic functions and recommended daily intake of these minerals from Table 38.3 in the 5th edition of the Sikon text on page 649. Similar to vitamins, these minerals are obtained typically from daily dietary sources. There is really no need for reasonably healthy adults to take supplements of minerals, as a good balanced diet should suffice. However, mineral supplements could be helpful when the body's demand exceeds the daily supply. Good examples of such supplemental needs may include calcium given in osteoporosis or potassium for patients who are on diuretic drugs, which are known to get rid of potassium, and the use of iron supplements in certain types of anemias. Overuse of supplements do not serve a purpose and may have dangers and toxicities that are easily avoidable. Summarizing some tips for rehabilitation professionals. Educate your patients that CAMs are real drugs and subject to same precautions, safety, and restrictions as prescription drugs. Patients should readily disclose all non-prescription substances and their use to their clinicians. Find opportunity to educate your patient that natural sources do not imply safety. CAMs such as vitamins can cause serious toxicities and should only be taken as supplements if dietary sources are inadequate or if medically indicated only. CAMs can cause serious drug-to-drug interactions with conventional medications. Final takeaway is that as a healthcare provider, you must continually evaluate current literature and stay up to date on new knowledge in the field. Do not take literature in the product packaging as your own source of information and remain leery that in the field of CAMs, facts are easily obscured and lost in manufacturer hype. That brings us to our closing slides and references. Here is the book reference for your reading. As always, practice good copyright rules. And for any suggestions, please email me at my office address. Thank you for your attention.